Welcome back to the deep dive. We are doing something a little different today.
Yeah, bit of a pivot from the usual.
Right. Usually, we're looking back at a historical event or dissecting a massive tech trend. But today, we are looking at a document that literally just dropped.
Hot off the presses.
Exactly. It is February 2026, and Health Canada has just released the Men and Boys Health Strategy.
And I know right away the phrase government strategy usually sounds like, well, the absolute cure for insomnia.
Oh, totally. I was prepared to skim through a lot of bureaucratic waffle.
I mean, that's the standard expectation.
But I actually spent the whole morning with this thing, and, well, it's heavy.
Heavy in terms of the subject matter.
Yeah, not heavy as in boring. I mean, the data in here is actually kind of shocking. It feels like they are finally saying the quiet part out loud.
That really is the feeling you get reading through the source material. It's this quiet crisis.
A quiet crisis.
Yeah. We've had these statistics lurking in the background for years, life expectancy gaps, suicide rates. But this is the very first time the federal government has put them all in one place.
And actually connected the dots.
Right. Putting it all together and saying, okay, this is a systemic problem.
That is the key word right there, systemic. Because I think for a long time, the narrative around men's health has been extremely individualistic.
Oh, completely. It's always framed as a personal failing.
Like, men just need to take better care of themselves. Men need to, I don't know, eat a salad once in a while.
Go for a jog.
Yeah. But this document is arguing that the issue isn't just bad individual choices. It's bad design.
Right. It's actively moving away from that blame model. The entire strategy is built on this core idea that the way we have socially and culturally constructed manhood is, well, it's actually biologically hazardous.
So let's look at the baseline data, because the why now of all this is super important.
It really sets the stage.
Starting with the life expectancy gap, I mean, I knew women live longer, but I didn't realize the gap was this stubborn.
It is incredibly stubborn. Right now, we are looking at an average life expectancy of 80 years for men versus 84 years for women in Canada.
80 versus 84.
Yeah. And now, 4 years might not sound like a massive chasm on the surface, but when you look at why those 4 years are missing, it gets really dark.
Because it's not just genetics.
Exactly. It's not just biology taking its course.
Well, and 4 years is a long time. That is an entire university degree.
Right.
That's the difference between knowing your grandkids when they're in high school versus elementary school. And the source material highlights this term, premature mortality.
Which is really the polite clinical way of saying dying when you shouldn't.
Right, preventable deaths.
Yeah. And if you look at the top causes of premature death, men are massively overrepresented in almost all the preventable categories.
Accidents, suicides.
And specifically, the opioid crisis. The data in this report puts men at roughly 70% of all opioid-related deaths nationwide.
70%.
Staggering.
That is just a staggering number. That's not a statistical anomaly. That is a clear pattern.
It is. And the report explicitly connects this to how men manage pain, both physical pain and emotional pain.
So it's the self-medication pathway.
Exactly. And this brings us to one of the most, I think, interesting behavioral insights in the whole strategy. They call it delayed help-seeking behavior.
The classic, I'm fine, I'll walk it off syndrome.
That's the one. The stat they cite here is that 65% of men wait more than 6 days after severe symptoms appear before seeing a doctor.
More than 6 days. Okay, I have to play devil's advocate here for a second.
Go for it.
Is that just pure stubbornness? Or is there something else going on? Because I know plenty of guys who aren't actively trying to be tough. They're just, busy.
Sure, life gets in the way.
Yeah, or they just don't want to waste a doctor's time for something minor.
It is a mix of things, definitely. But the strategy argues it is deeply rooted in stoicism. We are taught from a very young age that to be a burden is the worst possible thing a man can be.
A burden.
Yeah. If you go to the doctor, you are essentially admitting a vulnerability. You're admitting that the machine is broken.
And for a lot of men, that's a problem.
Especially those who tie their self-worth directly to their ability to work and provide. Admitting you're broken is a terrifying admission.
So the wait-and-see approach isn't laziness at all. It's fear.
It's fear masked as resilience. And the problem is that delay is deadly.
Because things get worse.
Right. It means a cancer gets caught at stage 3 instead of stage 1. It means the high blood pressure isn't managed until the actual heart attack happens.
Wow. Which leads us right into the culture section of this deep dive.
Right.
The strategy explicitly names traditional masculinity as a health determinant,
Yes.
which feels really bold for a government document. Usually they tiptoe miles around anything that smells like a culture war.
It is bold. But they are framing it purely through a health lens. They introduced this concept called the man box.
The man box.
It's a sociological concept. You have to imagine a literal box made up of unwritten rules.
Like what kind of rules?
Things like don't cry, don't show fear, always be in control, always be the provider. The strategy argues that staying inside this rigid box creates a pressure cooker environment for men.
And when the pressure gets too high, the lid just blows off.
Exactly. And you see it so clearly in the mental health statistics for young men right now.
The youth data in here is tough to read.
The data from 2012 to 2022 is honestly depressing. We saw self-reported excellent or very good mental health in young men ages 15 to 24 drop from 70% to 52%.
So from 70 down to 52, that is nearly a 20-point slide in just a decade.
Yeah.
That's not a slow drift, that is falling off a cliff.
And if you look at the time frame, 2012 to 2022 covers the massive explosion in social media, the pandemic, huge economic shifts.
Right.
And in that exact same 10-year window, mood disorders rose from 11 to 16%, and generalized anxiety more than doubled, going from 4% to 10%.
So we basically have an entire generation of young men who are objectively more anxious and significantly less happy, but they are still operating under this old code that says don't talk about it.
Right. Handle it yourself.
So how does the strategy propose we actually fix culture? Because you
Yeah.
can't legislate feelings.
No, you definitely can.
Like, if the federal government tells a 19-year-old guy to be more in touch with his emotions, he's going to tune that out immediately.
Oh, 100%.
Uh,
And the strategy completely acknowledges that reality. You cannot force a cultural shift. But what you can do is change the incentives and change the messaging.
how so?
The strategy focuses heavily on promoting positive masculinity. This is a crucial philosophical shift. It's not about criticizing men or telling them they are inherently toxic.
Right, which just makes people defensive.
Exactly. Instead, it's about expanding the very definition of strength.
I really like that framing, because if you just point a finger and tell men you're doing it wrong, they just stop listening entirely.
They absolutely do.
Mhm.
So the strategy poses these reframing questions. What if strength actually included vulnerability?
Mm.
What if courage looked like walking into a therapist's office to deal with your trauma? What if true leadership meant modeling emotional intelligence for your kids?
So it's about funding programs that model that specific expanded version of masculinity.
Exactly. Shifting the baseline of what it means to be a strong man.
Now, I want to pivot to the who of all this.
Yeah.
Because the report makes a really big point about not treating men as one massive monolith.
Right.
Men is not a single demographic.
This is the intersectionality piece of the document.
Yep.
And it is incredibly crucial because if you are a white, upper middle class man living in Toronto, your health outcomes are actually pretty good.
The crisis is concentrated.
Highly concentrated.
The report specifically flags Indigenous men, Black and racialized men, 2S LGBTQIA plus men, veterans, men in the criminal justice system, and men experiencing homelessness.
Let's take Indigenous men, for example. You have the baseline masculinity issues we just discussed.
The stoicism, the man box.
Right, the reluctance to seek help. But then you layer on top of that the profound intergenerational trauma of colonialism.
Yeah.
You layer on systemic racism within the healthcare system itself and often severe geographic isolation. It acts as a massive multiplier effect on the health risks.
So it's not just that they don't want to go to the doctor, it's that the system might actively mistreat them when they do go.
Or the services simply aren't even there in their language or their cultural context to begin with.
Right.
The strategy emphasizes that this isn't just a medical issue, it is a social justice issue. You simply cannot fix the health outcomes without addressing the structural racism, discrimination, and economic inequality behind them.
There was one acronym in this section of the report I really want to drill down on because I had never seen it used quite this way in a public health context before. NEET, spelled N-E-E-T.
Right, NEAT, not in employment, education, or training.
That sounds like such a sterile, bureaucratic term for basically being completely lost.
It really does. But they are talking about young men who have essentially fallen out of the economy and the social fabric entirely.
They aren't in school, they don't have a job.
Exactly. And the isolation for this specific group is profound. The strategy identifies being a NEET as a red zone for things like radicalization, severe depression, and substance abuse.
Which makes total sense. If you don't have a daily purpose and you don't have a community, you are going to find one wherever you can, even if it is incredibly destructive.
Yes, and that is exactly why the strategy proposes creating specific economic and educational on-ramps for these young men. Because you can't treat the clinical depression if you don't first treat the fundamental aimlessness.
That connects really well to the life course approach that the document uses. I thought this was such a smart way to structure a health strategy.
It's very effective.
Instead of just listing out different diseases, they list out transition points.
Because it's a timeline of risk. Health challenges don't just magically appear out of the ether when you turn 50. They accumulate over decades.
Walk us through that timeline, because obviously the risks for a 15-year-old are totally different from a 50-year-old.
Okay, so you start with adolescence. The primary drivers of health risk there are identity formation, the influence of the digital world and social media, and risk-taking behaviors.
This is where the initial patterns get set.
Exactly. Then you move into early adulthood. This is where you see that neat risk we just talked about.
Employment instability, trying to form long-term relationships.
Right. Then comes fatherhood, which I think our culture often romanticizes as this purely joyful, happy time. But the report flags it as a distinctly high-stress health risk period.
Really, why is it a health risk?
It's what you might call provider panic. Suddenly, you are financially and emotionally responsible for another human life. Financial stress spikes massively. Sleep entirely disappears.
Oh, I remember that.
Right. And historically, this is the exact moment where men stop seeing their friends, they stop going to the gym, and they sacrifice their own physical maintenance for the sake of the family unit.
Which kind of works for a few years, but then you hit midlife.
And that is when the bill comes due.
Yeah.
The complete neglect of your health in your 30s manifests as high blood pressure, diabetes, or heart disease in your 50s. Plus, you are often dealing with career plateaus and caring for aging parents at this exact same time.
The classic sandwich generation stress.
Yes. And finally, the last transition point they identify is retirement.
Which is the danger zone.
A huge danger zone.
Which seems so counterintuitive. You would think, hey, I'm done working. I can finally relax. Why is that dangerous?
Because for so many men, their work provides two foundational things, purpose and community. When you retire, if you haven't actively cultivated hobbies or a solid social circle outside of the office over the years, you lose both of those things literally overnight. The rate of physical and cognitive decline in men post-retirement is incredibly steep if they don't have a plan.
So the strategy is basically trying to identify these specific curves in the road and put up guardrails.
Exactly. The whole goal is early intervention, intervening before the crash actually happens.
Now, zooming out and looking globally at this issue, are we the first country to figure this out, or are we arriving late to the party?
We're definitely late to the party.
Okay.
But the advantage being late is that we get to look at everyone else's cheat sheets. Countries like Ireland, the UK, and especially Australia have been doing this for quite a while. The WHO Europe region has frameworks too. But Australia is a great example. They have had a national men's health strategy running successfully since 2020.
What does the Australian model actually look like on the ground? Like, is it working?
It is. They've been very successful by focusing heavily on community-based grassroots initiatives. The most famous one is probably men's sheds.
Men's sheds, like a tool shed.
It is exactly what it sounds like. They are these communal, physical spaces where men can go to work on projects, woodworking, fixing small engines, building things.
Okay.
But the real underlying purpose isn't the woodworking. It's the social connection.
Oh, that's clever.
Right. It gets men side by side, standing shoulder to shoulder. Because the psychological research shows that men often converse much better and open up more when they are actively doing a shared task rather than just sitting in a circle looking at each other.
That is such a deeply specific tactical insight. Just don't make them sit in a therapy circle, give them a wrench, and let them talk while they fix a lawnmower.
Precisely. And Canada is looking to adapt those exact kinds of shoulder-to-shoulder strategies. It's fundamentally about meeting men where they naturally are, not where the medical system wishes they would be.
Okay, I want to address the elephant in the room here. Or maybe it's the elephant in the comments section. Sure.
Whenever we talk about directing federal funding toward men's health, there is always a tension. People ask, don't men already have all the advantages?
Right.
Isn't modern medicine already entirely male-centric?
And it's a completely valid question to raise, because for decades, medical trials were done almost exclusively on male bodies. Women's health has been historically deeply underfunded, ignored, and misunderstood.
So there is a very real fear out there that launching a men's health strategy is somehow a step backward.
A zero-sum game mentality.
Exactly. The idea that if men get $1 of healthcare funding, women lose $1.
The strategy fully anticipates this point of friction, and it argues very clearly, explicitly, that this is not a competition. It's about complementary health.
How so? Give me the pitch for the document on why this is a win-win for everyone.
Think about the massive ripple effects of poor men's health. We talked about the opioid crisis earlier. We talked about high suicide rates.
Yeah. You can add domestic violence and family breakdown to that list. Who historically picks up the pieces when a man emotionally or physically collapses?
Well, it's usually the women in his life. Wives, mothers, daughters.
Exactly. Unhealthy men create an enormous, often invisible strain on families and communities. The strategy points out that if we can successfully reduce substance abuse, if we can improve emotional regulation and psychological safety in men, the safety and well-being of women and children in their lives improves drastically.
So healthy men actually make for healthy families.
That is the core logic. And frankly, the sociological data backs it up completely. When fathers are mentally well, their children's developmental outcomes measurably improve.
Right.
When male partners are physically healthy, the heavy burden of unpaid caregiving that usually falls on women decreases significantly. It's not a competition. Supporting men's health directly complements the ongoing critical efforts to improve women's health.
So a rising tide really does lift all boats.
It absolutely does.
Okay, so we have the rationale, we have the data, we have the plan. What is the actual goal of all this? If we deep dive 10 years into the future, and we are looking back, and this 2026 strategy was a massive success, what looks different in society?
Well, based on the vision outlined in the source material, I think we would see a fundamental shift in the culture of masculinity.
What does that look like practically?
You would see a world where young boys feel completely safe expressing a full range of emotion, where a guy can say to his boss, "Hey, I'm really struggling right now," and not have to worry about being quietly passed over for a promotion.
Workplaces prioritizing actual psychological safety.
Yes.
Hmm.
You would see young men viewing going to therapy as just as normal as going to the gym. And crucially, you would see the opioid death numbers plummet, and that horrible suicide rate line finally start to curve downward.
And maybe you'd see men actually going to the doctor before their leg is literally about to fall off.
That would definitely be a great start. But truly, at its core, it is all about connection. The opposite of this health crisis isn't just medicine, it's connection.
That is powerful. So if you are listening to this right now and you are thinking, okay, this all sounds really good, but what can I actually do about it? Well, Health Canada is actually throwing that question right back at you.
They are. They have opened up a massive public questionnaire to shape the final implementation of this strategy.
And the timeline for this is happening right now. It runs from March 2nd to June 1st, 2026.
And they're making it very clear that this consultation is not just for doctors or policy wonks.
They want to hear from everybody.
Everybody. They want fathers to weigh in. They want teachers, mentors, coaches. If you run a local minor hockey league, they want to know what you were seeing in the locker room. If you are a community leader, what specific barriers are the men in your neighborhood hitting?
So how do people actually participate?
You can submit your thoughts, your experiences, and your feedback directly via email. The address is Men's Health Santa Masculine at he-se.gc.ca.
And we will put that email right in the show notes so you can just click it. But seriously,
Yeah.
if you have an opinion on this or if you have lived experience with the gaps in the system, don't just yell it at the dashboard while you're driving. Write it down and send it in.
It is a genuinely rare chance to help steer the ship. Documents like this usually set the federal funding priorities for at least the next decade.
Wow.
So if you think they are missing a crucial angle, or if you have an idea for a community program, you need to tell them now while the window is open.
It really feels like a door is finally cracking open here. For such a long time, the default strategy for men's health in this country was just silence.
Total silence.
And now the proposed strategy is dialogue.
And that cultural shift is the final frontier. Because at the end of the day, government policy can build the clinics and they can fund the programs. But culture is what determines if men actually walk through those doors.
Yeah.
That part is entirely on us. The future of men's health isn't going to be written just by a policymaker in Ottawa. It is going to be written by the guy who decides to finally make that scary phone call to a therapist.
Or the dad who tells his young son that it is perfectly okay to be sad or scared.
Exactly. If traditional masculinity shaped the poor health outcomes historically, then a new, positive culture has to be the cure.
That is the ultimate takeaway to mull over today. The government has written the invitation, the conversation has officially started, but we're the ones who have to choose to participate. The shift from silence to dialogue is here, but the door only stays open if we walk through it.
Well said.
Thank you so much for diving deep into this one with us today. Make sure to check those show notes, click the link, fill out that questionnaire before June 1st, and we will catch you on the next deep dive.